some other academics' presentations can get really boring, and if I'm going to be bored, at least I want to be bored by someone who talks fast. So I'm going to try and talk fast, and I may speed up, thanks Blair, at the end. The second thing, it's not vanity, it's just my name on the presentation instead of all my fabulous co-authors, because I thought of putting their names on it, but this is really integrating my research. So if you want to know about my fabulous co-authors, including a bunch from Cancer Council, then you can look at my publications. This whole conference is about social marketing. And one of the reasons I put this presentation in is I got annoyed by a whole lot of academics talking about how their research was impactful when really what they were talking about was very often citation counts. So can we take it for given that impact is not citation counts? Academic citations in the immortal words of Julia Gillard, they do explain something, but they don't explain everything. But she was talking about Tony Abbott, another story. They don't show meaningful impact. If you're not convinced, look at another strand of my research where we talk about coercive citations. You know, you get an article back and the author, anonymous reviewer says, great article, but cite Burton, Burton and Burton, and you think, I wonder who the reviewer is. That's a coercive citation. Impact these days is about contributing to hopefully useful effects on society. And because I'm an academic, I thought I should put up the proper definition of impact. Research impact is the contribution that research makes to the economy, society, environment or culture beyond the contribution to academic research. And if you're at the Meet the Editor session at lunchtime, you would have heard that impact is becoming more important for accreditation. It'll be more important if the Australian government brings back the ERA exercise. The good news for social marketing academics is it's usually difficult to establish meaningful impact. That's why many of us like to use citations. But it's arguably easier for social marketers because, hey, a whole part of our raison d'etre is about changing things. I'm preaching to the converted if I say social marketing ideally results in impactful change. Usually, I would say incremental change. There may be examples of breakthrough changes in social marketing, but I think they're pretty rare. And my research certainly reflects, I would say, incremental change. As you'll see, I've been working in the area of tobacco control for a long time now. You'll hear how long, but reflecting that incremental change, in the time that I've been working, we've moved on tobacco on full display in an average of 18 tobacco outlets per postcode. Think about how many that is to what we have now in New South Wales. It varies in different states, but tobacco is off display, so they're much more of a temptation. We still essentially, as one participant in my research said, have a price list and a warning sign, which one of them said was it's like an advertisement saying we sell tobacco here, but we know this is less tempting than the open display. We could go a lot further. I was in Alberta recently in Canada, who have gone further than us, and they have zero signs that tobacco is on display. This was in a service station in Alberta. Why am I talking about this? Well, because I have a long history in social marketing, or when I started, I think we called it demarketing. Again, you can look at my pubs if you care. You have other things to do in life. Don't look at my pubs. But it's really about tobacco control, particularly looking at the effective distribution, how tobacco being sold in every supermarket, every gas station, just about every convenience store, every newsagent, though they're disappearing, how how that drives tobacco sales. And my whole stream of research, and it probably made my career, was driven by a former very insightful CEO of Cancer Council New South Wales, who was interested in changing policy in New South Wales and throughout Australia. So my very first stage in this area, it shows how old I was 20 years ago when I was a very young academic, when there was a call for expressions of interest from Cancer Council New South Wales to business and health academics on investigating the impact of distribution of tobacco on smoking and failure to quit attempts. It's very wordy, but you know, as you develop an area, you realise everything is complicated. But Cancer Council's aim, and still is policy change and prevention. We got some very limited funding, $10,000. I guess that'd be worth $20,000. But they said to a bunch of academics, would you like some money to do a thought piece, to suggest some research? So we ended up this peculiar team of 4 academics, 2 professors, hint I wasn't a professor at that stage, and 2 junior academics from marketing and public health. And we wrote a report together, and the 2 professors had some ideas and us 2 junior academics had different ideas. So we proposed different ways of investigating any possible effects of distribution on smoking. So there was a recommendation to Cancer Council New South Wales. You probably all know, whether you're in business or not, part of success is managing the seniors. So we managed to carve off the professors and we said, really interesting idea. You do your submission, we'll do a separate submission, and guess what? We won and we got rid of them. So we, the junior researchers, got funding from Cancer Council New South Wales, and this miracle of miracles turned into an ARC linkage grant, which probably made my career. 1 ARC linkage, and it probably got me my professorship. And I will say I was lucky. So part of the lesson is persist. So we started with, there have been lots of studies. So what I'm going to throw at you is a couple of what I think are the most interesting studies, hopefully give you some ideas and also show you the long line of research which is often needed for incremental change. So one of the studies I'm proudest of was this first study. It was a diary study, which is still underused in marketing, in social marketing, of the behaviour of smokers and attempting quitters over 4 days. We got a publicly available address list and we gave them a 1 in 20 chance of winning a $100 shopping voucher, and we gave them this really complicated paper survey asking them to record, I advanced too fast, when they bought cigarettes or when they were tempted to buy cigarettes every 4 hours over 4 days. And we asked, where were you? Were there friends and family smoking, etc. So with another co-author, we did some very clever quant analysis, and we found, unsurprisingly, if friends and family are smoking, people are more likely to smoke. If other people you don't know are smoking, you're more likely to smoke. Environmental effects, who would have thought it? Duh. But what we saw, and it was the first evidence, if people saw cigarettes for sale, they were more likely to smoke. So it was the first good evidence that the mere sight of cigarettes for sale drives people to smoke. You know, this is about building evidence. Remember, biased research, as Russell Belk was saying, my goal is and was to change the policy. Part of social marketing, you know, if you want incremental change, you have to follow up. So I have been incredibly lucky working with Cancer Council New South Wales because, frankly, I'm an academic. I want to work at my desk with my students. I don't want to be out there talking to politicians, to the media, to the Minister of Health, the Health Department, but I will if I have to. But there are experts in communication at my partner organisation, Cancer Council. So they and I had input into a state parliamentary inquiry into POS, point of sale display of tobacco, and after some time, this doesn't happen with one study. We met with politicians and we did reports and we lobbied, etc. We got policy change. In New South Wales, cigarettes were removed from display, and that policy was subsequently followed by every Australian state and territory. I think the ACT may have been before us. I've forgotten, lost in the mists of time, whether we were the first, but I can put my hand on my heart. I will not say, thank you, I didn't cause it, but I contributed to it. But as an academic, I'll tell you later, you know, I've let it help my career. And of course, we did academic impact and another lesson here. We published in impact, in addiction. Guess what? Addiction is in ABDC, but it's a B-level journal. Dear God, it's got a really high impact factor. It's not an A or an A star. So there's some lobbying there. In social marketing, if your dean doesn't accept Q1 publications that aren't A or A star and ABDC, lobby your dean. But we could talk about that in questions if we have time. So I'm not sure this was study 2, but the second interesting study followed on from the previous one, because if I was an evil tobacco seller, I would say, well, once we have cigarettes off display, selling tobacco in every convenience outlet is not a problem because they're off display. There's a problem of causation. Does distribution cause sales? Do people sell them? Do people buy them because they see them, because they're easily accessible, or do sales lead to distribution? Obviously, outlets want to sell any product for which there's high demand. So we wanted to counter the potential tobacco industry argument that selling cigarettes is not a problem once they're off display. So we did another diary study, but this one was quite different. We gave people, smartphones were out there, but they weren't very well developed. We gave people a voice recorder and a camera, and we had 3 stages. We did in-depth interviews where we talked to them about what they thought caused them to smoke or buy cigarettes. We trained them in the use of the mobile phone and the dictaphone, sent them away, and we said for 4 days we want you to record whenever you're tempted to buy cigarettes or to smoke. And then we got them back. And then we did some re-interviews. Given there's a bit of time, what do you think? Methodologically, it was complicated, but I've fallen in love with diary studies because if you ask people by survey what influences them to buy, they've forgotten. They don't know. They make up sensible reasons. But if you give them a voice recorder or a smartphone these days, you can capture their thoughts at the point of time. So there are 2 papers on this, but we struck gold. I was really worried we would find no evidence. And frankly, we designed this as a trial for a larger second ARC, and we never got the second ARC, but we found the evidence that we were looking for. We found the black swan, if you know that metaphor. We got a range of recordings where people said, yes. Some of them took pictures, some didn't. But someone says, I took a picture of the Edamoga pub and also Dan Murphy's. They're the types of triggers, or I suppose I'll call them triggers. They're the types of things I look at or I drive past. That's the type of stuff that makes me sometimes want to crave a cigarette, etc. Now, it makes sense. I hope none of you are smokers. But, hey, you don't need to walk into a McDonald's to crave McDonald's if you eat McDonald's. The sight of the outlet can trigger impulse sales. Now, that's not such a problem for the heavy smoker, but it's a real problem for the person who's trying to quit. And if you don't know, tobacco, I've heard, is one of the most addictive quality products there are. So what do we see? What did we see with this evidence? We saw clear evidence of retail distribution, especially the side of tobacconists, liquor stores and pubs, resulting in the urge to buy cigarettes and smoke cigarettes, because as several participants said, smoking and alcohol, they go together hand in hand. We found very strong evidence that smoking areas, especially in alcohol licensed premises and restaurants, result in higher levels of smoking. And we found that evidence of audio recordings and re-interviews can result in additional and stronger information. You'd have to read the paper to find that out, but essentially when we got people back, they said, thinking back, when you first asked me, I said the sight of tobacco stores doesn't trigger me to buy, but it does, I've realised. So after that, another study which I thought was interesting, again, which part of the story, the reason I'm talking about this is about partnership. Because if you work with a partner organisation like Cancer Council, you're likely to be able to mobilise lots of volunteers. And that's what we did in this study to investigate tobacco outlets in New South Wales. Now again, there are differences in every state, but in New South Wales, where I'm from, tobacco retailers are required to be listed with the New South Wales Ministry of Health. There is no cost for listing. So anyone can set up, as of now, up till July 1, the story is evolving, but there's no cost for listing. And that's partly why there are so many tobacco outlets. New South Wales has what's called a negative licensing system. If you break the laws repeatedly, though you have to try really hard, if you sell repeatedly to minors, or if you sell illegal tobacco, your right to sell tobacco can be withdrawn. But so in theory, there is a complete list of tobacco retailers in New South Wales. And when we asked the Ministry of Health, the Department of Health, they said there is. It's wrong. In practice, the list contains multiple listings for the same outlet. We found up to 12 listings for one outlet, retailers who no longer sell tobacco, and it leaves out a whole lot of outlets which do sell tobacco. This makes enforcement of tobacco retailing very difficult, and it also means there's no money to support enforcement. In some of the other states, tobacco retailers need to pay an annual licence fee, and that annual licence fee is quarantined for enforcement. So then there's a proper list of tobacco retailers, and there's funding to fund health inspectors to go out and find the baddies. So this is the wonderful thing about working with Cancer Council. As I said, sometimes you can mobilise volunteers. So we got 166 volunteer data collectors, including me and some staff at Cancer Council, but a whole lot of volunteers from Cancer Council, and we recorded data from nearly 1,800 tobacco retailers across New South Wales. So the auditors, me and lots of others, looked for breaches of display regulation, and we also looked at pricing of the leading brands and if the business had closed or no longer sold cigarettes. What did we find? Ridiculously wide distribution of tobacco. Nearly 18 retailers per postcode, if per postcode means anything to you. Many unlisted retailers, completely illegal. 1 in 4, around 25% of retailers were breaking the law. And we found pricing activities which I would say were suspicious, but they seemed designed to increase smoking. Discounted cigarettes, prices significantly lower in some outlets, and very suspiciously, prices for tobacco were lower in the country than they are in the city. Almost nothing is cheaper in the country than the city. So that to me is suspicious. Again, we were looking for outcomes. So we got a New South Wales government task force formed into tobacco retailer licensing. I've been told by a public servant that there's never change unless they have a task force. Once there is a task force, there may or may not be change, but that's your first goal. And finally, from July, there will be fundamental changes to licensing of tobacco retailers. And of course, we got an outlet, an academic publication. So for you who are academics, You also want to establish the impact of your stream. Again, I smile because it was almost luck. The ARC, Australian Research Council, had an impact assessment exercise, and I was asked by my university to submit as impactful research. Frankly, it was a nightmare. It took weeks or months of my time, but sometimes I think there is a God. My research was labelled high impact, and years later, the ABDC website still has what they call great examples of impactful research by Australia's business schools. Mine is in position number 1. Amusingly, it used to be down below the cut-off screen because my dean and my associate dean research forgot to reply to the email. I wasn't asked. And nobody asked me if it could be labelled cigarette promotion. It's not cigarette promotion, but I have been able to lobby this with my dean. Well, of course I'm a valuable member of staff. My research is high impact. But most importantly, what do we want as individuals, as social marketers? We want impact. And finally, as I said, we're getting fundamental reform of tobacco licensing in Queensland, New South Wales and Victoria. The East Coast used to be like the dark side. Victoria has done brilliant research, and they were the worst of all, but they are finally coming online. So from July 1, there will be changes. So again, as academics, if you want to do impactful research, if you want to get promoted, my suggestions would be, well, decide on your goal. For me, it's, depending on the policy, a task force and longer term change. I'd say collect evidence from the past. Collect evidence as you go. Part of the nightmare for me building a case for my university and the ARC was I've forgotten when I talked to politicians, when I presented to the Ministry of Health. So start a file named Impact and start writing notes. So when you go for promotion or assessment of impact, you have a file. Develop a research report and communications material written for lay people. Use public relations and media, mobilise supporters. These clips at the bottom, they were all developed by the fabulous people at Cancer Council, not me. Cancer Council are great at media. Lobby, make submissions to government, do briefings to your stakeholders, target politicians, and keep going. It's a long, hard road these days being an academic and being a social marketer, but sometimes if you persist, you get lucky. Thank you very much. I should have spoken more slowly. Now you've got 7 minutes for questions, and there probably won't be 7 minutes. Questions, comments?